Morning, my name is Kevin Moser. I'm the Vice President of Operations, and that doesn't mean that I'm over everything in surgery. Actually, that means that in general at the hospital, there's a Vice President of Nursing, and she is over everything nursing, and I pretty much have most of the rest of that. Clinically, I oversee everything in radiology, lab, as well as PTOT and speech therapies, as well as food nutrition and a few other things. So I've got a real diverse employee base, if you will. I'm an athletic trainer by profession, and so that's how I came up through the clinical ranks, just to illustrate who I am. But I think, knowing that I was on a panel, and I didn't know, but I figured I was going to be toward the end anyway, I wanted to take a different slant on some of these items. We talk about soft skills, and a couple of them that we've talked about, but I think a couple of them need to be reviewed so we could add to it. Because one of the hardest things we talk about is communication, but I think what really needs to be understood from your part of what is adequate or effective communication at first is, and I see it as something is really got to be worked on by some of our staff that comes on, is recognizing the patient's level of understanding. And I think that's really, really important. And I would, knowing your audience is really important when you walk into the patient room and start talking. I also think that giving them, providing the patient and their family, adequate feedback. A lot of times you're going to start the conversation. They may have another couple questions, but you really need to give them some adequate feedback so that they understand and you understand that they understand. That idea of repeat back to me what we just talked about, your plan, what we were going to do, etc. And I think you need to also expect that the patient has real concerns and fears. And some of those are going to be based on wild information, folklore, crazy stuff, the internet. Expect that. Don't scoff at it, don't laugh at it, don't dismiss it, because it's real, and if they think that something is what they need to do, and you're like, that's not even scientific, we don't do that here, you've got to be able to expect that that's going to happen while you're in healthcare. So just be, that way if you dismiss them, they may just end up dismissing you. We talk about professionalism and dress code, and you're going to, if you join a lot of different organizations, they all might have a variation of either a very strict dress code or a very loose one. But I think if you perceive the idea that your dress code should not be a distraction to that healthcare moment. If I came here to talk to you dressed like a clown, you would laugh. And you would not necessarily take me seriously. So when you look at dressing each day, you need to look at it that you don't want that to be the distraction. You want it to your message. Another thing to understand is you need to expect diversity. And I say that because whether it's meals, so if someone's a vegetarian, expect that people have different food choices and different meals other than your own, as well as celebrations and loss. So how someone, a family, or a patient celebrates a birth or a death, it doesn't always have to be yours. Expect diversity in that response. And also under that idea of expecting diversity is personal space. Some people are big huggers, and some people will put an arm's length at it before they even get close to it. Expect that. You need to learn that in your conversation with your patient. And lastly, what does that all do? Those are all things that I'm asking you to be concerned about. But in actuality, one of the most awkward parts about you going to your workplace is that you are awkward if you can't do that. And so I always say, if you learn these soft skills, you will have a much more meaningful work moment. And you also, therefore, will then have a greater appreciation for your own work. We are looking at, how do we hire the best? I expect clinical expertise, but what I'm looking for is someone who can put all that together with critical thinking and be able to differentiate yourself from others. Thank you very much.